All right, let's jump in. Good morning and welcome. I'm Dean Miller, President and CEO of PACT, and I want to welcome you to our webinar on the PACT Solution Builder member benefit. We are going to talk about benefits. I know if you're on this call, you're interested in benefits, but I will point out that historically, this is kind of been one of those must-have, but not a lot of innovation, kind of sleepy type of area, right? Sign up, get your benefits, pay a lot more every single year to deliver a basic level of benefits to your teams. And so PACT, we've been exploring a whole host of different member benefits. And when I say different, differentiated, things that are truly different than what you could get in the market. And we're really excited to launch the PACT Solution Builder product in partnership with Exude. So what does it do? Well, you're going to find out. We're going to spend some time and hearing from two individuals, both PACT members and PACT member companies. More on that in just a second. And you'll have the opportunity to ask questions. This is structured as a webinar. So we ask that you use chat to post your questions. And if we need to elevate people for more in-depth conversations, we can certainly do that as well. So let's get to it and hear what is different, truly different about PACT Solution Builder. And I'm just going to provide my own perspective on that here for a second. We've seen many different types of companies in our region, and PACT is a compilation of the largest enterprise companies on down to the smallest startups and everything in between. Companies of the size and scale of Comcast, Independence Blue Cross, Vanguard are all self-insured. Many of you probably on this webinar know that. And as a result of being self-insured, they have flexibility to do different things for their employees. They also can do a more interesting, are more capable of controlling costs in a real fast rising healthcare cost environment. What this Solution Builder product does is make you more like the Comcast and Vanguards to compete for team members, for staff, for talent. And so let me introduce our two panelists or presenters here this morning. We're fortunate to be joined by Greg Grimm, who's an executive with Exude. Exude, as you know, has been a longtime provider of benefits to companies of all sizes and scales here in the region. Greg, again, one of the leaders of that organization, specifically focused on the Solution Builder product. So welcome, Greg.
Thank you, Dean.
And we're also excited to have with us Nora Leco. Nora is a talent leader at Think Company, again, another PACT member company, and they've been taking advantage of the relationship with Exude to continue to develop their benefits offerings for their staff. And Nora is here to really provide that firsthand experience and perspective on the Solution Builder product and what it can do for attracting and retaining talent. So welcome, Nora.
Thank you, Dean.
All right, with that, I'm going to turn it over. Chris, myself, and Nora are going to go off screen and let Greg introduce the program. Again, use chat to post your questions. We'll all be tracking it, particularly Greg, and we'll come back on for a bigger discussion with Nora just in a few minutes. Take it away, Greg.
Excellent. Thank you, Dean. Can everyone see my screen? Looks like we can. All right, let's get it going. So what I want to do is just, again, we went through some introductions. Thank again, Nora, for joining us. And Nora, as Dean mentioned, will join us after we go through a couple of slides talking about Solution Builder, PACT Solution Builder. What is it? How does it work? And Nora will give us kind of a real life example of some of, again, the challenges they face as an organization and some opportunities that they see here offering benefits. So let's get into today's objectives, right? So today is all about talent. How do employers offer better benefits, right? And really, why do they matter? So we're going to spend some time talking about the why. Obviously, the last 20 months, the employees' needs are continuing to evolve, and the benefits strategy has to reflect the culture and the benefits needs. And so we're going to give you some highlights of why this really matters, a part of your talent and retention strategy. Then we're going to get into PACT Solution Builder. Simple. What is it? How does it work? Right? And really, how can PACT members take advantage of this process and this program for offering better benefits? We're going to spend a little bit of time on the funding or financing. Healthcare and benefits continue to be very expensive. So we're making sure, how do we creatively finance, right, your benefits, whether if it's through self-funding, like Dean talking about, or voluntary, or even traditional fully insured benefits. Having a mix of all three is producing the best-in-class strategy on how to afford benefits for your employers. And then we're going to jump in with Nora again, talking about case study and making sure we can give, again, her perspective of what's been working the last almost year and a half to 2 years. We'll definitely leave some time for some questions. So please, as Dean mentioned, use the chat function and we'll spend some time together answering some questions after we go through some of the slides. All right, so better benefits, why do they matter? Well, really, benefits are such a huge part of the total reward strategy, attract and retain talent, right? And over the past 20 months, people took inventory of what matters, right? Whether some were under heavy pressure for the type of role they played in the organization, or frontline workers, or now an individual became a teacher for the first time with their children. The impact of working remote, right? So the types of employees' roles continue to evolve. And when we look at benefits are traditionally reflecting the needs of employee, right? And so right now is a perfect time to reevaluate what is our current benefit strategy, and are we really having the pulse of the people that we serve? And now, as employers look to really bring employees back to the office, they need to refocus on what matters. You hear this term, the great resignation or the great discontent, right? That benefits really are on the forefront of how to keep employees engaged, right? There's a 2021 Gallup poll that's saying 48% of working population are actively searching for new opportunities, right? 11 million Americans resigned in April, May, and June, right? Reports of record high numbers of unfilled positions. 74% of employees now are actively disengaged, okay? And 62% of employees think benefits are more important now due to the pandemic, right? And so the era of cool office perks is just not enough, right? A fridge full of beer is not a substitute for leaders who truly care about their team members and want to make the lives of their employees better, right? So again, it is a talent war right now. We are helping employers offer better benefits and making sure that PACT Solution Builder, right, is a key component of making that happen, okay? So let's get into it, right? So I mentioned PACT Solution Builder, right? It allows smaller and mid-market employers really to access more diverse benefits and really providing some more flexibility of how to pay for them, right? I think most employers want to offer great benefits, right? They don't want to have high turnover. They want to attract and retain talent, but more and more employers we're seeing are missing the mark in the types of benefits. So part of PACT Solution Builder, we have a really intentional 4-step process to devising a multi-year strategy that makes sense for your organization. One thing you'll hear me talk about is benefits have to reflect culture and budget. We work with startups and tech firms and 100-year-old nonprofits and manufacturing. They all can potentially have very different types of benefits and different strategies, okay? So first, how do we know we're offering the right types of benefits? Nora's going to talk a little bit about this as well. We think it's super important to understand the needs of the people that you serve, whether if it's surveying, focus groups, right? Making sure you cannot miss when you offer the types of benefits. The landscape of employers have dramatically changed. It's no longer this parental unit of an employer where I know what's best for my employees. Here are your benefits. We're going to talk to you once a year about it. Go ask your significant other or spouse and deal with it for the rest of the year, right? It has to become a very dynamic push and pull mentality of what benefits we're offering. Got to get a pulse of the people to be able to know what types of benefits you want to be able to offer first and foremost. Second, risk tolerance and financials, really important. I have a slide here that we're going to talk about. What are the different ways we can finance our benefits, right? And so truly understanding where do you fall as an organization on risk tolerance? What are your current financials? How did the pandemic affect that? And what do we foresee our 2, 3, 5-year strategy down the road? Then getting into the creation of this solution, right? Making sure what types of benefits we're offering and how do we get to a good conclusion of what they look like. And really most importantly, step 4 is the rollout. We have to improve the employee experience because we as employers spend all this time and all this money, working on benefits and and choosing the benefits we want to offer, and we fall flat on communicating or serving the employees throughout the year. Every one of our clients has a client care specialist that's dedicated to their employees. And Nora will talk about Monica, part of our team, how she is now instrumental in Think Company in the way they handle their benefits, right? We call them our benefit ninjas. They are the employees who are the frontline facing with our employees, frontline facing any questions or concerns about their complete benefits package. Okay, so again, really clear 4-step process, making sure we have an idea what the needs are, what types of benefits, how to finance them, and really work on the employee experience. Okay, so now what are better benefits? Again, we are seeing a huge shift in what types of benefits are being offered. Again, I'll go back to the pandemic and really what this is causing. It's really employers to look at what are we offering, right? And are they the right types of benefits? And I'll highlight a couple of these because I think they're really important on what we're seeing kind of thrusted into the market, right? One, mental health. This might be the most requested benefit we've seen in the last 10 months, right? Now, and mental health comes in all different facets, whether if it's through your health insurance, through a separate, additional benefit that you're buying up through an employee assistance program, but you need to have a strategy, right, around mental health. You probably saw in the news, Headspace and Ginger just merged. Headspace was a meditation app. Ginger is a teletherapy app, right? They merged now, create a $3 billion mental health company, offer employer-based mental health benefits, right? And so what we see, our job is to vet some of these products, right? Because it can be overwhelming. We literally have new products coming to the market every day. And so when we go through this exercise saying, okay, what types of benefits are best suited for your employees? Okay. Next one I'll mention is tuition assistance, right? We all probably saw the article and the response to Target of saying, look, we're going to give every employee 10 grand a year, right, for tuition, and not just reimbursement. We're going to assist them in tuition. Well, now not every employer can, have the budget of Target to offer 10 grand a year, right, in tuition assistance, but there are tuition reimbursement or assistant type of applications and third parties that can help you budget. That might be a great fit for a small per employee per month fee, right? That maybe it's something your population is really wanting, really needing, that'll help you attract and retain. The next one is, I think it's important to see, something like the childcare component, right? We talked about different roles that employees are playing and different needs. Well, now individuals are becoming, they need more help with childcare, or they're becoming a caregiver for elderly, an individual part of their family, right? How we've seen care.com now run into the employer benefit space, where you can subsidize or reimburse maybe some dollars each month to help your employees, get some of that care for some of the people they're serving at this point. Now there is financial wellness, right? Again, there are more and more financial wellness apps, or the employer is paying a bigger role in supporting the financial well-being of an employee. An app called Nudge, right? This coaches employees to better understand their finances, right? And so what we mean by better benefits, it's a diversified offering, right? And the key component is this, is making sure you really truly understand the right types of benefits for your organization. Again, I can go into many more, not to overwhelm, but a huge part of our role is making sure we're really intentional in selecting what are the types of benefits that the people that you serve need at this point. So you're probably saying, look, yeah, we all want to offer better benefits. How do we afford it, right? This is the part that Dean mentioned, when we're looking at affording the benefits, right? How do we make sure that we're diversifying our financial strategy? Okay, self-funding. I have a slide or two I want to talk about self-funding, but self-funding, especially on the medical and prescription, is becoming much more prevalent and really much more advantageous that employers are looking at, right? And so what we mean by that is self-funding is now you are, in a very safe environment. We have access to an exclusive consortium that you're now paying for your utilization, buying catastrophic insurance, but paying for your utilization rather than going to an insurance carrier, paying premiums every month to then at the end of the year figure out, did we have 10 people go? Do we have 100 go? And we kind of get an increase, but we're not sure why, right? Again, very individual conversation. Groups are self-funding medical, dental, vision, all types of different benefits. But the important piece is, what is the right strategy in these three different circles, these three different buckets that best suit my employer? Fully insured, right? This is pretty standard. As Dean mentioned, you pay the premiums, you have coverage each month, right? Making sure at the end of the year, you get a renewal and you say, hey, we need 10% more to access the same benefits, and the reason why. Some employers we work with, this really works. I wouldn't advise on switching from it, or certain products really work to be fully insured to have fixed premium. Really important, right? That you're going through a financial analysis to figure out which makes the most sense. The third is voluntary, right? We're seeing a really increase offering involuntary benefits, which means the employee pays for the entire thing. Take something like pet insurance, right? More and more employers and employees are asking for pet insurance, but you know what? They don't want to pay towards the benefit, but we're going to give access to the benefit, right? So someone like a Nationwide, right now, if I have 100 employees, we're going to say, hey, Nationwide, you can come here, you can offer, right, pet insurance, but the employee is going to pay the premiums, and the actual, when they go to use it, they pay some of the copays. Might be $5 a month, but you're offering it as the employer in, right, a concentrated environment, and you're getting a reduced rate. You're getting a discount that if someone would get it off, on their own individually, right? And so again, identity theft, pet insurance, some disability insurance, all through voluntary. The key portion of this is, how do we best utilize the dollar being spent, right? And so a lot of our clients have again, a strategy in all three of these circles. And the biggest one, though, is on the medical standpoint, right? And I think this is, again, what Dean mentioned in the front. We have an exclusive program with a consortium that allows mid-market employers to self-fund their medical and prescription in a safe environment. And there's a lot of terminology on the page here. I'm just going to go over to high level because it is absolutely a more individual employer conversation. But the key is this. Look at the two different rectangles. The dark blue rectangle is your typical fully insured health insurance. Let's say you're paying $500,000 a year. Each month they whack it times 12, right? Divided by 12, and you're paying that each month, depending if someone jumps on the plan or off. But no matter if 10 people use it, 100 people use it, or one person uses the type of benefit, you still pay those premium dollars. What we're seeing, and I'll give you a couple of examples of some clients we're working with, we're seeing like, hey, there might be, depending on the risk and the demographic and the people, again, within your part of your organization, there might be a better way, or I'd say a more way we have more control over cost and transparency to do this. That's in the right-hand column, right? That's creating this PACT solution builder funding, okay? What you're gonna see, this rectangle, right? It's made up of fixed cost and variable cost. Sometimes we can still take that $500,000, right, cost for medical and RX and apply it to this program, but now 400,000 is variable, right? And if you have 10 people who use it, or 8 people, or 4 people, right, you're going to save, and depending on the utilization, you could save tremendous amount of dollars if you're not spending all that $400,000 on medical and RX claims. So not to get too granular, but the point is, when you're looking at self-funding, right, please look at the ability that you might be able to good fit to self-fund your medical and RX. This year, 100 employee group we're working with, we've returned 25% of their premium, right? So when we talk about better benefits and how to afford them, imagine what that does at the end of the year. Now you're getting a check for $125,000 back, right? Because you have a self-funded medical and RX plan, where now you can diversify. Well, yeah, we can offer pet insurance on a voluntary basis, but we can offer disability, or we can offer a mental health component, right? Or tuition reimbursement, increase in 401k, right? It really frees you up to make sure, are you being overinsured? And do we have the right types of plans and financing structure, right, for the right type of benefit we're willing to offer, okay? So again, just a little bit more about the partially self-funded health plan. It is in a very safe environment. You do buy catastrophic insurance if you have high claimants, but you're going to see a ton of transparency and control. Most times you're using the same networks that you have now, depending on the size of the group. You're going to offer, plan design control, right? One of the things that we've seen is that, let's offer free generic drugs or prescription drugs, right? Where it's saying, why not we want to incentivize people to get certain care, right? You can now flip the script as a smaller employer that was once kind of designed for large employers, right? Where you can have some of these creative benefits or plan designs that are really improve and enhance the employee's experience, okay? And again, cost. This is something that you're going to see 100% of that surplus. You talk about if you run better than what's expected or better than what the actuaries see what your projected costs are going to be, those are your dollars being spent. I think one thing that's really frustrating right now for some employers is seeing these increases, right, of trend or medical trend being 7-10% each year and saying, what's going on with my healthcare plan? Why is it increasing 15% in its compound interest, right? How many years can you really take of those increases and not understanding the reason why, right? And so what we're saying is that absolutely look at is self-funding or partially self-funding healthcare plan, is that in your future? Does that make sense for your population? One of the other key components to this that I'll just mention is that once you're part of this self-funded plan, right, you have nurse navigator, you have employee advocates, there's a wellness consultant, right? We really want to work on, right, this gray bucket, right? Because this is your variable claims. If you can reduce that, now some things are out of our control, but if we can really, put good behaviors and have people see physicians and doctors and things we can control, those are your dollars being spent. You can really save a part of your medical and RX. Okay. So again, before we bring Nora on, just a couple of key components to remind of the solution builder. One, we take a really intentional process of what types of benefits should we be offering, surveying, making sure we're doing focus groups. What is the financing? How do we finance all these different benefits? What are the perfect types of benefits for your organization and the employee experience? How are we continuing to have a best-in-class employee experience throughout the selection of your benefits, the ongoing communication, and when they actually need it, right? When they're using the types of benefits. And one of the biggest components of this is the ability to self-fund your medical. It can reallocate dollars back to your benefits strategy throughout the year. Okay. So Nora, do you want to pop on again? We'll join and we'll go through a little bit more about your experience and maybe some of the challenges you faced and I think success stories and opportunities you see for the future. So maybe why don't you just do a little bit of quick introduction about your role and who you are within the organization.
Sure. Hi, everyone. I am Nora Leco. I work at Think Company. We're a user experience design and development consultancy based here in Philadelphia. We have about 130 employees as of right now. And due to the pandemic and everything, we've really expanded our reach across the entire United States in terms of talent. So our benefit strategy was key in being able to do that. Our employees are our number one asset and so important to us. So we just want to make sure that our employees and their families are well taken care of. So that's one less thing they have to carry the mental load of when they come to work each day. So
awesome. And maybe kind of start off, let's talk a little bit about your benefit strategy, or at least maybe a year and a half ago and kind of evolving, right? So how did you go about understanding some of your employees' needs?
Yeah, so at Think Company, we have a lot of ways in which employees can provide feedback. So that's one thing that we is always at the forefront. But in regards to our benefit strategy, we took into consideration where our employees are located, knowing that we had to move to a PPO plan nationwide. And then we've also did benefit surveys as well as focus groups to learn more about the individual needs of our employees. And then from there, we had our findings and we worked with Exude, who everyone should just dump who you have now and start working with Exude.
I appreciate that. And I think, but one thing we found right away with Nora and the team was that, number one, you had a very vocal, team members, which is amazing, right? And I think doing the survey and the focus groups was like, all right, there was definitely some systematic challenges, right? I mean, obviously you guys were super intentional about the strategy, about what you did, but I think as your demographic you served was continuing evolving, there were new probably opportunities to offer different types of plans, right? And I think one of the things that I remember seeing was just even on some of the like, all right, I don't understand the plans, right? And maybe just talk a little bit about, I mean, some of those challenges were things you could see that were kind of systematic.
Yeah, absolutely. So our organization has changed like dramatically as well. When I first came on, it was like 8 years ago. It was a very young company. Everybody's fresh out of college. And then we're starting to move into like people getting married and having babies. So all of our, everything shifted. And the questions that we were getting from employees are things that me being in benefits, I think are just like no knowledge. But it was very like simple things like, what's the difference between a deductible and a copay? What's like, what does this mean if I go out of network? Like, how do I know what's in network? So we had a lot of educating that we had to do around our benefits. And that was part of what Exude helped us with as well, was our challenges around explaining our benefits so that they're better understanding, so that our employees better understand them.
Awesome. So let's talk a little bit about the approach to financing your benefits, right? Because it was obviously working together right away. It was like, all right, I think company cares about their people, right? And so let's offer all the benefits. So let's really, but budget is obviously, culture and budget are two really key components to a benefit strategy. So maybe even that first year, I think one of the things we learned was like, look, I think you guys, we were overinsured, right? I think you had super rich benefits because again, you were like, we want to attract talent. But it was like, hey, I think there might be some spend here we can reallocate, right? And I think maybe just talk a little bit about that process, kind of what we went through, and you know, maybe some, again, changes we made or how we reallocated some of those dollars.
Yeah, absolutely. So we did learn that we were well overinsured, that we were paying a lot of money for our benefits, and a lot of them were going unused. So between the surveys and the focus groups that we did, we found out what was most important from our employees and what are the most used things so that we could really focus in on that and reallocate those dollars towards that. So we ended up switching carriers and changing plans and just reallocating some of the dollars that we had. We instituted an HRA for our prescriptions.
Yes.
And that went a long way as well. So just having, like, even though we were still fully insured, having that flexibility in being able to tailor things to what were important to our employees was really a game changer. And it made us feel like we had some control in the game, which was fun from my perspective, because usually it's just like, okay, here's the plan. There you are.
Wait, rush, right? Yes.
Yeah, exactly.
And I think that's really important, right? So Nora talked briefly about the financing piece, right? And so we did remain, you know, and Think Company remained fully insured, right? We went through kind of this, you know, self-funded consortium. Okay, we went through the financials. Said, look, at this point, right, doing multi-year strategy, it's best to remain fully insured. But you know, we're going to take pieces of the plan out and kind of self-fund that before we kind of make the step and go fully self-funded, which we're obviously working through this year to see if that potentially fits. But, you know, Nora made a good point. It was like, we felt that there were some things we were overpaying for. So why not, let's reimburse if employees use them, right? Like a fourth tier on a prescription drug. We were being charged, you know, probably 5 percentage points more every month for having this benefit where it's saying, look, let's allocate some dollars. And if we use it, yeah, we'll reimburse a certain portion of it. So there was zero impact to the employee. But now we're seeing, you know, 10 months into it, that was again, a game changer where we're saving some dollars, you know, for the overall cost of some of these benefits, right? So I think, again, you know, going through that financial exercise of what's our strategy this year and multi-year, super, super important. Nora, maybe give us some examples of these better benefits that either Think Company has, you know, has instituted over the last year, or maybe planning to in the upcoming renewal coming up.
Sure. Within the past year, we instituted the voluntary pet insurance through Nationwide. We also brought in a buy-up vision plan so that people had more flexibility around vision, because that was one area that we were not lacking in, but could get better. We also instituted the HRA for our prescriptions. And then this year, we're really going to be diving into the mental health support, potentially self-funding our plans. and looking into an FSA this year to go along with our plans.
And I thought one thing that was a great outcome was again, from an attraction retention standpoint, is now we offer a high deductible plan that is free, right? To all employees, their dependents, their spouse, their families, right? I mean, so from a recruiting and retention standpoint, right? I mean, to offer a free healthcare plan, right? That's pretty attractive, right? And again, it doesn't cost the employer any more money. We're reallocating dollars. We created a really defined contribution strategy and what we're looking at to offering. And again, you know, it's going to take some time. We had a handful of individuals kind of work, you know, enroll in the plan, but the education piece is huge. But again, from attraction and retention standpoint, you know, you're leading the market saying, look, yeah, healthcare, we have a free plan, right? It's pretty advantageous when you look at benchmarking compared to other, you know, competitors in the market.
Yeah, that's the one thing that we do hear from employees all the time is like, this is a completely free plan for us. And I was like, yeah, they're like, nobody does this anymore.
Right.
So
Right.
it's great that we were able to do that and that we had the flexibility to do that.
So question on the impact of employee experience. I think that's really important, obviously, you know, given kind of what you do as an organization, how engaged you are with the employees. Maybe just talk a little bit about the impact of an employee experience working with Exude, you know, kind of in this, again, this PACT solution builder process. Would be helpful to, you know, kind of highlight some of those things.
Sure. Yeah. So I was very hesitant to relinquish control over being the point of contact for our employees, because response time and just making sure that they're not waiting on an answer was something that is very important to me, to just give people what they need to move on with their day. But Monica and the team at Exude have like completely blown all expectations. So we have a lot of like ongoing support and education, both with Monica, and then we also have Caitlin that we work closely with at Exude, and our employees are able to call in anytime they have questions. And there's like, we're getting any feedback that we're getting has been great feedback about working with Exude. But just having that extra, we call it an extension of our team. So it's like they're all thinkers as well, is like game changing in terms of our employees having the information that they need when they need it. And that has been beneficial to all of our employees as well. So just the communication, giving our employees what they want and educating our employees so that they better understand their benefits has been awesome to have the extension.
It's great. And I think, you know, anytime that you're offering new plans or changing, I mean, it's a lot, right? Because, so, you know, as Nora mentioned, like we, you know, especially I live in the space every day. Nora's, you know, subject matter expert, she's dealing with it. But some of these employees, maybe could be 27, jumping on the plan for the first time, right? And they're like, benefits? I have no idea. Just what is my mom and dad's plan?
Mm-hmm.
Season benefits, right? Or individuals who've been, you know, in the space, working space for many years, but now they're taking on a high deductible plan or an HRA or some of these, again, where anytime you're making change, the education and communication are so important for making sure the employees understand, right, their benefits and increasing the experience. So especially as new benefits evolve, like I said, you know, the last 20 months, there's been, employees have taken on so many new roles, and the benefits need to reflect that, right, the needs of employees. And you're going to see some new, you know, benefits, and whether if it's policies or perks, so these things coming in the market where communication is really, really important. Mm-hmm. So maybe last question for you, Nora, what's next on your benefit strategy for Think Company?
Our benefit strategy is really just to hone in, especially as we keep expanding nationwide, just getting better at offering benefits, better understanding the needs of our employees, and then hopefully being able to really hone in on our like mental health support this year is going to be a big initiative for us, as well as just offering more inclusive benefits so that everybody feels as though they have the coverage that they need for whatever they're doing within their lives.
Awesome. And I think one thing we're also going to look at is some of the pulse surveys you mentioned, right? So I think last year, our first year working together, we did a little bit more extensive, maybe 10, 12 questions, right? That we kind of worked together to make sure we can get, you know, good feedback. We're going to probably, you know, look at 3-4 questions, quick pulse surveys, just to hone in on a couple of different, you know, areas to again, continue to get the pulse. And especially as your recruiting strategy is evolving, the people that you serve, the demographic, that's all evolving. So the benefits need to be kind of in lockstep. So yeah, I think we have a good strategy for the upcoming renewal. So
Yep, feeling good about it.
excellent. Well, Nora, thank you so much for spending time. I think it's always great to hear from, again, a PACT member, a current client, someone who's kind of working through this process, some of the challenges you face, and I think, the big opportunity for, 6, 12, 18 months coming up.
Yep, awesome. Thanks for having me.
Excellent.
Nora, Greg, we've had some excitement. We had a couple of spammers join. So obviously, it's a very hot topic that's attracting people from all over. But really appreciate you both participating and Nora providing your perspective. Benefits get such a bad rap, right, Greg? Yeah, it's just like you got to have them. Yeah, it's painful when you see those year-to-year increases. But small and medium-sized companies are really challenged by this, not just in terms of access to good benefits at a reasonable cost, but creative thinking around providing what you're all doing, for example, at the Think company. No longer can you just say, oh, well, we're a small company, we don't do that, right? Because you're competing for the same talent and ideally for the top talent from these organizations that are sitting in self-funded programs with unique benefits. But what we're here to tell you today is you can do it. Does it take a little more work? Yeah, you got to get smart around what's available. You need to think about allocation of resources. But what you're all hearing on this is that it is absolutely achievable. Companies are doing it. And Exude is an incredible partner in this regard. They really bring expertise, talent, and access. And we haven't really hit upon that. But Greg, this is not an approach that every benefits company takes. You kind of are out on the front edge of this, particularly doing it for small, mid-sized companies. Can you just mention a little bit about that?
Yeah, so I think it really revolves around the dollars being spent and the financial risk tolerance, right? And so what we wanted to do is really start shifting some employers who are that 50, 100, 150 to a self-funded platform and a consortium that we have access to that's very limited. That it would self-fund in a safe environment. And what I mean by self-funding in a safe environment is alleviating some of the risk of self-funding. So, self-funding was for employers of 1,000, 2,000 employees, but the cost of care has gotten so expensive where employers are going, you know what, there's got to be a better way to do this, right? And so we have this consortium that we're obviously giving to the access to PACT members, right? That is a safe environment to self-fund where you have access to best-in-class catastrophic insurance, right? If you do have those high claimants, but really the control and the transparency that you can see what types of utilization you have as a population, and then put really good programs in place to help those individuals, to help the utilization continue to be maintained, right? And so again, the access is really important. We go through, there's no commitment. We go through a really intentional process, see if financially, if it makes sense. But that's how we're allocating dollars. I mentioned we have story after story of saying, look, we return 10%, 15% of premium, right? What that can do to your better benefit strategy is incredible for an employer of 75 employees.
It's not discriminatory either, Greg. That might be important to touch upon. This isn't, hey, just give us your healthiest people. We'll do that for them over here, and the others are over there. Can you touch upon that a little bit?
Yeah, exactly. So every potential client goes through a process in which, depending on the size, we have data, utilization. If not, we look at renewal history and there's a disclosure form, right? And so the last thing we want to do is, Nora told you, we sit agnostic, right? It doesn't matter to us which way you fund, but we want to make sure we're scrutinizing it. And so last year with Think Company and Nora and the leadership team, we felt, look, we're going to hold off. It doesn't make sense this year. Let's see if it makes sense next year. But there's other ways we can kind of pick at this and what levers to pull to really scrutinize the cost, right? But we're all inclusive, making sure, does your population make sense to self-fund in a safe environment in this consortium?
Does it cost anything just to even go through the evaluation process, Greg?
Absolutely not. And so this is, again, a perk for PACT members, our partnership. We want to have these individual conversations. So obviously you see next steps here, right? It's each of employers have different strategies, whether if it's, culturally or from a budgetary standpoint, what makes sense. And so talking about, okay, what are your current strategies? Do we see any kind of a gap analysis and getting to understand the organization better holistically and see what the strategy look like for the upcoming year? We'll review current offerings, right? We did a lot of benchmarking and culture studies and again, surveying to see what aspects of the plan might make sense to continue to work on. And then we'll recommend a strategy, right? Again, if it makes sense for you to stay with your current provider, your current consultant, have at it. At least we had a good experience of giving you a second look, a second opinion. We really feel it's really important, again, to walk through our 4-step process to make sure you're offering the right types of benefits for the people that you serve.
Yeah, you touched upon something, Greg, earlier in the conversation. I forget what you called the folks within your shop. What was the
Benefit ninjas?
Benefit ninjas. This is a really important one because the benefit ninjas that Exude has formed within their organization really are designed to help steward this process beyond initiation, right? I mean, this is maybe not completely unique, but it's unique among brokers like yourself that are focused on a small mid-sized organization, correct?
Yeah, it's a really good question. I think again, to highlight it, it's we are a service-driven mentality from a consulting standpoint where, yes, it's super important. We're really financially sound and the consulting piece is amazing, right? But having the support when your employees are actually using the benefit, it is very difficult to understand and navigate healthcare. It is. And so, we specialize this again. Every one of our clients has a dedicated benefit ninja or client care associate, right, that helps them navigate this, right? And so whether if it's lost ID card or I don't understand a deductible or a copay or what is out of network or out of pocket, right? They are calling our team. And then we're working with the employers to give stewardship report and say, look, this quarter, we've had 15 calls on this dental program. We need a communication piece now. Right. And so making sure, and again, we have the ability to, our advocates aren't clinical, but then we get them in touch with kind of that liaison with the clinical expertise that we have through a third party that we work with. Right. So we have a third party we work with called Cancer Cares. Right. So when an individual, a part of this program gets diagnosed with cancer, we have a second opinion right away. Right. Because we know 40% of cancer diagnoses are misdiagnosed in a certain stage. Right. And that could really depend on what type of care this individual gets. Right. And obviously the cost as well, but it's all about the human first and the care. Right. And making sure that we have the correct really communication strategy to get that to improve that employee's experience. Right. So those are some of the pieces, to your point, Dean, that are so important, a part of this building better benefit strategy.
Yeah, Greg, nothing produces anxiety like your healthcare plan is changing. What do you do specifically, to address that anxiety from, we've got leaders on the phone to heads of talent and HR on down to the employees. Yeah, how do you address that, that potential?
Yeah, first and foremost, right, this is part of like the risk conversation and really and the change type of conversation, right? We have many employers that go through this, depending on your size. You can keep the same benefits, the plan designs, the network, right? All we're doing now is changing who finances, who pays for it, right? And others saying, look, I'm ready to take a little bit more of an aggressive approach, where then I'd say, you know what, if you're going to, we're going to have cost calculators and things that say, look, we know that it's more expensive to get an MRI over here versus here. And if you get that MRI with a better outcome and less cost, there's no copay, right? And so it all depends on calculated risk, right? And so I think that's really important as you look at this navigation. Look, we're willing to meet you where you're at, and we have an implementation specialist that walks you through every step of the way, because you're right. Changing healthcare is really potentially really scary and really important. In I saw my statistic, 63% of people now after pandemics realize how important more important benefits are in healthcare, based upon what happened in the last, 22 months.
Next steps, Greg. If I'm sitting on this call right now and asking my question, okay, what should I do? I'm kind of frozen. What are the best next steps here?
Yeah. So reach out, right? I mean, send an email, right? Again, we're a PACT member. We're here to support. We've been really intentional about the PACT solution program. So making sure that we have this individual conversation, right? Like I said, all employers are different, whether risk tolerance, culture, strategy. let's get to know kind of what's working, some of the challenges maybe that you're facing, and we'll walk you through our process, right? Or even if it's just a second look to say, hey, you know what, my renewal is coming up. I'm not ready to switch. I'm not ready to change, but can you get a second set of eyes on this and just see what are some of the things that you're seeing in the market and give a comparison? So very informal. There's no commitment. We're here to support, and again, reaching out via email or phone, we're more than happy to do so.
You've got Greg's information here. Chris from the PACT team is going to send out another call to action, to the whole registration list, and we certainly encourage you to explore this new PACT member benefit. The Solution Builder product is unique. It's different. Again, as Greg said, it's not for every organization, but note that it is truly a differentiated approach that allows small and mid-sized companies, and many of them on our space, right, in the high growth space, are looking to compete with bigger employers. This provides you the tools to be able to do so. Nora, Greg, I want to thank you, for your time today, for your presentation, Nora, for sharing some of the insight and wisdom that you've experienced. And Think Company is known as one of the top employers in the region. So the fact that you're, again, working with Exude as you grow your base and grow it nationally, that's an important piece here for those on the phone, particularly in COVID. No longer are organizations just simply thinking, oh, I only have to worry about people within one geography. Not the case, right?
Correct. Yep.
But thank you again to Greg, to Exude, and to your partner, Marcos Lopez. As many know, Exude has been around for decades under the leadership of Marcos and Greg. And again, just grateful for your partnership here.
Thanks again, Dean. Appreciate it.
All right. Thank you, everyone, for participating. You'll see an email from Chris Kantz as a call to action, and we hope you take advantage again of this new PACT member benefit. Have a great day.
See you later.